Good evening, everyone. I thank Dr. Gupta, Dr. Nag ma'am for giving me this opportunity. I'm presenting 5 translational research paper in this rapid review section. First paper is study of soluble E-cadherin as a novel prognostic biomarker and driver of brain metastasis in inflammatory breast cancer, presented in SABCS 2022. So hypothesis was soluble portion, that is the extracellular domain of the E-cadherin, is elevated in inflammatory breast cancer patient, and it may be used as a prognostic marker in these patients. And so method was, first of all, 348 patients with the inflammatory breast cancer in whom the levels were analyzed and overall survival analyses were done. Apart from that, in vitro and in vivo studies were also performed, and mass spectrometry and bio-ID based proteomic assays were used to understand the basic potential mechanism. Coming to the results, high level of serum soluble ECAD levels were associated with poor overall survival in these patients. It was established in the multivariable analysis as well that they are associated with the poor overall survival. In vitro, these higher expressions were associated with anchorage independent growth, migration, invasion, and resistance to the anoikis. And in vivo, where it was injected into the, where it was enhanced into the cells as well as in the mice, it was associated with higher tumor progression, metastasis burden, and the number of metastasis and worse overall survival. When they try to analyze the possible mechanism, it was found that it is associated with X-linked inhibitor of apoptosis protein, which is a potent inhibitor of apoptosis, as well as it was found to be principally attaching to the BIR2 base domain, and most probably it is working to the NF-kappa B pathway. So this was the final pathway which was presented in the abstract, and in conclusion, it was shown that in the given number of the patient, higher serum level was associated with the poor overall survival. They did find out they do analyze the potential pathway, and it has also, authors conclude that this may uncover a novel and crucial role of ECAD in brain mets and provide a new insight and potential therapeutic target for the patient with metastatic inflammatory breast cancer. My take on this is that soluble ECAD may act as one of the potential predictive marker also, maybe if we analyze it serially while the patient is on treatment. Second is why only inflammatory breast cancer and why only in brain mets, we also need to study that. Second is radiomic phenotype of breast cancer texture in association with the breast cancer risk and masking. It was presented by Dr. Wenham group, and the background is the best parenchymal pattern is a known radiological images are associated with breast cancer risk, and they can be quantitatively measured using the parenchymal patterns, and it can be applied to a system where we can actually evaluate the risk for the breast cancer. So in this extensive study, around 30,000 patients data was collected, out of which like 20,000 were in the training group and 10,000 women were in the test set. Eventually, around 390 radiomic features were identified and further validated. Two methods, hierarchical clustering and the principal component analysis, were finally used for the development of this. And later on, it was applied to the breast cases as well as in the control set. So after doing the analysis of these radiomic phenotype, there were final six clusters of principal component were generated, and there were hierarchical components were also generated. They were studied against the risk of invasive breast cancer, and they were adjusted for the age, BMI, and the density. These radiomic phenotype cluster remains significant even after the adjustment. These improvement in the discrimination of invasive breast cancer after the inclusion of PCN cluster were more pronounced among the black women. Further, the principal component and the cluster were significantly associated with the false negative overall case detection as well as symptomatic invasive carcinoma patients, but only principal component remained significant after adjusting age, BMI, and the density. Masking also improved with the inclusion of both cluster and principal component. So this is the exhaustive list of the various parenchymal characteristic which was studied. And they did identify a radionomic phenotype which can be helpful in further reducing the false negative and interval carcinoma cases in these patients. However, my comment on this is that it remains significant only in the black women. So we don't know what would be the ethnicity based differences in these. Then the third study is it was published in the JCO 2022 June. It's a study of breast cancer. Breast cancers are immunogenic, immunological analysis, and a phase 2 pilot clinical trial using mutation reactive autologous lymphocyte by Dr. Nicholas et al. This study is basically part of the 2 clinical trials ongoing for tumor infiltrating lymphocytes in solid tumor and adaptive cellular therapy in solid tumors. Breast cancer is, we have seen that the response to immunotherapy have been modest in breast cancer, and in this study, basically in the first phase, tumor infiltrating lymphocytes have been identified, and then later on, various interventions have been applied for the increasing the effect of adaptive cell therapy. So in the breast cancer cohort, around 46 patients were originally they underwent biopsies from the metastatic sites. Their tumor infiltrating lymphocytes were isolated. Then they tried to identify the various exomic non-synonymous tumor mutations available, and then they were screened for their immunogenic potential. Later on, these patients were enrolled for the tumor infiltrating lymphocyte transfusion after a short course of chemotherapy. So coming to the final results, out of 42 patients, nearly all had some TIL available. However, only 28 patients had TIL which expressed immunogenic somatic mutation, out of which only 13 patients showed a robust activity which can be appropriate for the adaptive cellular therapy. In the results, 1 patient out of 6 had a complete response in all the metastatic lesions. 2 patients had a partial response and 3 did not respond. So authors did conclude that there is a tendency of natural immune response. However, out of 46, only 6 patients got enrolled in the trial and only 3 patients responded. So not all, that may not be the true interpretation. Adopted transfer of TIL is a highly personalized experimental option for the patients with metastatic breast cancer, shown to be capable of mediating objective response in this pilot trial and deserve further study. However, in these all patients were heavily pretreated, and complete response in 1 patient is also encouraging. Next abstract was Interact Print Predict Clinically Meaningful Interaction Between Cancer Epithelial Cells and Immune Cells. Lesson from a single cell breast cancer atlas by Dr. Zhu et al. It is very similar to what earlier has also been discussed. Intratumoral heterogeneity, which is a marker for low response to immunotherapy, and intratumoral transcriptional heterogeneity is used as a surrogate marker for the intratumoral heterogeneity. Then single cell RNA sequencing can be performed to evaluate this heterogeneous group of the patient, group of the tumor cells. And in this study, around 240 cells were isolated from around 119 breast tumor samples of 88 patients. And they basically underwent supervised and unsupervised clustering. out of which 10 stable 10 stable groups were identified, which were called gene elements. And these gene elements were basically, they were found to having an action against the specific group, out of which GE5, which was associated with allograft rejection, complement and immune inflammatory response related, and it was also found to be related, having a good response to the CD8 T cell mediated reaction. So, so this was the methodology they decoded. They constructed a nomogram, and then this was analyzed. The researcher analyzed the data of two clinical trial, and this two clinical trials, and this performed better than the PDL1 based probability scores compared. Their interact print performed better than the PDL1 expression level in predicting the response to the immunotherapy. So
last 1 minute.
Yeah. So in conclusion, this T cell interact print was performing better than the PDL1 levels in these studies. Last is development of automated liquid biopsy assay for methylated marker in advanced breast cancer, presented by Dr. MJ et al. And background, I will skip, we are running short of time. Basically, the routine testing takes around 6 to 7 days time, and to reduce this, researchers have tried to further improve upon, and they have come with a prototype machine where the whole test can be performed within around 4.5 hours, out of which only 15 minutes of the hands-on time. And liquid biopsy breast cancer methylated protocol basically had performed very well in with the high inter-assay reproducibility, inter-user reproducibility, inter-platform reproducibility as well as, and the ROC curves are very much compared to the currently used liquid biopsy methods. So they stated that automated liquid biopsy cartridge prototype is a fast, at the performance level equivalent to highly sensitive but manual c-Myth DNA method. However, further studies are needed. Strength of this assay is that it is done within 4.5 hours, where we take like week for the formal reporting, and only 15 minutes of hands-on time. The weakness of this study is that only 40 patients' data has been generated so far, so it will need further validation. With this, I thank